Hi, everyone. So, in this lesson, we're going to talk about self awareness and how it applies to the therapeutic process. So, before we get started there, let's do a little bit of review. So, if you remember in our previous lessons, we discussed a few things. We talked about how you feel about yourself can and will affect how therapeutic you will be with others. Remember, we talked about how this would apply socially, how you interact socially with others, and also professionally, such as with your peers or with your practice administrators or even with your patients. And then we also talked about how many factors influence your personal communication skills. Remember, we talked about the economic factors, the life experiences, those moral values, and the genetic factors as well. And remember, we said these factors are neither good or bad. Remember, we said that they're just different. They're simply just a part of who you are. This is your heritage, your culture, and your lifestyle. And we also talked about how they impact our lives. They dominate how we feel about ourselves, and they also impact how we feel others perceive us. So, to accomplish the rest of this therapeutic communication, what we need to do is we need to be self-aware. So let's talk about that just a little bit. So self-awareness in the therapeutic process. Well, to begin the therapeutic process, we must recognize and evaluate our own actions and responses in certain situations. We have to be familiar with ourselves. So it's important for us to know ourselves before we can begin to understand others. We must know how we feel about things. We also must like ourselves in order to like others. So, what exactly is self-awareness? Well, it's defined as being aware of oneself as an individual. And this includes knowing our beliefs, being aware and understanding our behaviors, how we are going to act or react in situation. Simply, why do we do the things that we do? It also includes the mental image you have of yourself. And this includes the realistic image you have. And then it also includes that unrealistic image that you have. And, crazy enough, this this image begins to form at an early age. In fact, it's well established by the time that we're 6 years old. We have these life experiences that happen up until that point that begin to influence how we see ourselves. So let's talk about those just a little more. Now, we can't do much to change those life experiences. We can't change many of those things that influence our lives. However, what we can do, remember we said we can learn from them, right? So we first need to recognize those influences. And then we need to evaluate how they affect who we are. What type of effect do they have on us? Then we can begin to change as we need to. This is part of that learning from those life experiences that we were talking about. And this is done by conducting a self-assessment. So I don't know if you have ever completed a self-assessment, but they're really interesting. They're a very valuable tool because sometimes they get us to thinking about things about ourselves that we normally would not have ever recognized or thought about. And they help us determine who we are. And when I say that, it helps us determine who we are as we see ourselves. But in addition, it helps us determine who we are as seen by other people. And I think one of the cool things about it is that it points out our characteristics, both the positive characteristics and the negative characteristics, because we all have them, right? Um, Now, we cannot change them if we're not even aware that we have them. If we don't know that something exists, how can we possibly try to change it? Okay? And change is good. Change is good because it encourages growth. So it keeps us from being stagnant, okay? Or it keeps us from just staying in one place all of the time. And it keeps us from avoiding that change. So it's a good thing and it helps us to grow. So when we're talking about self-assessments, one of the things we have to talk about are the four selves. This is called the four selves within us. We each have three selves, okay? We have an ideal self, we have a public self, and also a real self. Now, some psychologists actually recognize and say that there is a fourth self, and this fourth self is called the critic self. To have positive self-acceptance, you have to be familiar with all four of those, okay? And there must be congruency between them. And I'll explain that here in just a minute as we start to explore each of those selves individually. Let's take a look. So first we have the ideal self. And the ideal self, this is who we think we're supposed to be. This is the way we think we should be. Okay, we get these images from what others tell us or from what we see. So it's who we would like to become. Remember, we talked about those role models. Remember, we talked about Steve Jobs, we talked about Michael Jordan, and we talked about Maya Angelou. These are the people that we think this is what we should be. Okay, that's the ideal self. Then there's also the public self. Now, the public self, that's the person that we want everybody to see when we go out in public or we're around others. Okay, we can have several different public selves, and this all depends on who we're interacting with. So, for example, one thing I always tell students is, there is a way that you act at home and there is a way that you should act in the workplace, and those two things are very different. And that kind of talks to this public self, the way that you interact with your friends, or the way that you are with your family, and then the way that you are when you are in the workplace. Those are all different public selves. And another one that I really wanted to bring up is, what about social media? I know how many times I know I can certainly attest to it, that I have friends that are on my Facebook, and I know them outside of Facebook, but you only see one aspect of them on Facebook, and that's that public self that they want to throw out there, but it might not necessarily paint the complete picture, okay? And the public self is also what we call our reputation, all right? Now, the real self. Now, the real self, this is our inner self. It's who we naturally are. We're in our most authentic form. This is when you have your you're spontaneous. And that spontaneous is when you do things without even thinking about them. It's how you act with someone, or how you interact, how you respond, how you do things, but without even thinking about it, without even preparing for it. This is when we are in our most true form. This is the person that you are when no one else is looking, right? Very different from that public self, right? Even very different from that ideal self. Now, we are transparent to others. Whenever we let our guard down and we allow someone to see that real self, we make ourselves transparent. But it's only when we let our guard down, and usually we're very selective at who we allow to see that real self. And then we have the critic self. The critic self, as you can see on this picture here, this is our own inner shaming voice. This is what we tell ourselves. And we tell ourselves that we don't meet others' expectations. Okay? We're not good enough. We're not pretty enough. We're not thin enough. We're not smart enough. These are things that we tell ourselves internally because we are trying to meet the other standards and expectations of other people. And this can start in our childhood. And honestly, this usually is passed down from one generation to another. Um, and I say that because sometimes it's passed down from grandparents, and then it's passed down to parents, and it's passed on to you. It can occur in families with secrets, maybe some in families where some infidelities have occurred, or maybe there's been some sort of a drug or alcohol addiction, or maybe even some form of abuse, whether it be emotional or physical abuse. And this self causes us to keep quiet in some situations. And and we do that, we keep quiet because we're trying to keep up that appearance. Okay, so for an example here, maybe at some point in your life, you were upset about something and you were crying, and maybe somebody said, "Oh, don't cry. Only crybabies cry." And so you learned through that experience that you can't let anyone see you cry because that makes you weak. That makes you a crybaby. It doesn't make you strong. So anytime you are presented with situations that are very upsetting or sad, then you are trying to keep up that appearance and you're fighting back that urge to cry. Now, what it can do, remember we talked about that real self, right? That was your authentic self, that one that's spontaneous. You do things without acting. You let your guard down around some people, and it's your truly who you are. That is your natural person. Well, sometimes this critic self can camouflage or even suppress that real self. So kind of think about this same situation with the crying. Maybe you do become emotional at certain things. That's your real self. That's your one of your levels of sensitivity. But you suppress that down when you're around some other people in order to avoid criticism or shame. And it must be well understood to avoid undermining our real self. So we must understand, are these expectations, that maybe are really coming from others, or are we being more hard on ourselves than others truly are on us? So remember, understanding ourselves and knowing the basic components of communication that we've talked about. We've talked about the sender, the message, the receiver, and the mode of transmission. All of these things are vital to establishing those therapeutic communication relationships with patients. Because remember, our patients, they come to us when they're going through some really hard times, right? So they may be anxious about things. They may be incredibly worried about things. They may be experiencing pain, and this may be physical pain, or it very well may be emotional pain, because they're going to be very ill, right? And remember, they have these four selves too. So if they're experiencing pain, for example, what if they are one of those that tries to suppress some of those emotional feelings if they're having this physical or emotional pain? This is how we have to break open that communication line so we can get them to talk to us. Remember, that's what therapeutic communication is all about. So we can get them to open up to us so that we are able to assist them with their healthcare outcomes. Great healthcare professionals know and understand themselves. They know who they are. They know their strengths, they know their weaknesses, they know where they have opportunities to change and to develop, and they understand that while they may not be quote unquote perfect, they are the perfect form of them. So we strive for openness. We want patients and others to be open with us. We want to gain trust from them, okay? We want to support them. In addition, we want to receive support. And then we also want to give respect. And at the same time, we want to receive respect as well. So a few final thoughts here. Understanding these factors and how you feel about you directly impacts your therapeutic communication with others. So keep in mind, I know I've said it a couple of times, and I don't think we can say it enough, that we all have differences. You're different than me, I'm different than you, we're different than the next guy, and these differences are not good and they're not bad. It's just simply different. It makes us who we are. And remember, our experiences, they shape our personalities. Remember, we talked about those life experiences, and those life experiences shape how we act and how we react in certain situations. And remember, those life experiences also influence our fears, our goals, and our dreams. So I have a challenge for you. I encourage and challenge you to complete the I am statements exercise that's in chapter 1. It is a series of questions that is going to ask you, and you will complete them, and it's all about you. Okay, this is the time it's all about you. And what these exercises will do is they're going to stimulate your thinking about you. It will assist you in making these assessments about yourself. Remember, I said if you've never done one before, maybe you're not aware of some of the things that you do. Maybe you're not aware if you have certain facial expressions, or how you feel about this or how you feel about that. And with these self-assessments will help you be more aware of those things. Because remember, if we're not aware of them, how can we possibly change or improve them? I think what you'll notice is that you will likely discover something new about you. And then once you finish that, ask yourself these questions. Do you accept yourself as you are now? Okay, sure, you should, right? Even though you accept yourself, it doesn't mean that there aren't opportunities, right? We all have opportunities to make changes, opportunities to improve. So the next question would be, would you like to make changes? Okay, if so, why? Or even more important, what changes would you make? And if not, why not? What is something new that you learned about you? That's what's really important, is take a look and see what you didn't know about yourself before that assessment, and what do you know now? And what does it mean? How will it apply in your life? So take that time to self-reflect. Take that time to do self-assessment, right? Because remember, in order for us to like others, we have to like ourselves. In order for us to take care of others, we have to take care of ourselves. And remember, there is only one you. Remember, we talked about those genetic factors. We talked about how we have, you have height, you have body structure, you have gender, but remember that personality, everyone has that very different, unique personality. No personalities are exactly the same. Now, maybe there are some similarities. Maybe there are some same interests. Maybe there are a few same things that they don't like, but they're never going to be exactly the same. So there's only one you. Take the time to get to know you. So I encourage you to complete that I am exercise. Again, that's in chapter 1. Take a look at those questions, answer them about yourself, and see what you come up with new about you. So I hope you enjoyed this lesson. Until next time, take care.